Money FM 89.3, the best of the afternoon update.
Today we're diving into the role of AI in the medtech sector, and joining me now is Vikram Kapur, head of Bain Company's global healthcare and life sciences practice. Good afternoon, Vikram. Great to have you on the show.
Good afternoon, Lindley. I'm very excited to spend the afternoon together with you.
Now let's talk about AI's presence. It's growing, right, rapidly across many different industries, but in medtech, its impact is particularly profound. So can you start by explaining how AI is currently influencing the medtech sector?
Absolutely. Look, I think it's very hard to have a conversation in any sector, specifically healthcare, without talking about AI and the role it's playing. I think AI has a tremendous opportunity in medtech to be able to support, frankly, the entire ecosystem of medtech, all the way from how devices are used to how devices are made and how devices are designed. And I think, if you look at in Asia Pacific in particular, there's just a meaningful opportunity, not just more broadly in medtech, but in terms of the role AI can play in accelerating the evolution of this ecosystem.
And I understand Bain Company's recently released a report highlighting the growing influence of AI in this particular sector, as well as AI's impact on product development, research, and patient outcomes. So how do you see AI transforming this space?
Absolutely. And, maybe I'll start with just contextualizing. If I look at Asia Pacific, I think in terms of just the scale of the opportunity, first of all, Asia Pacific is home to the number 2 and number 4 medtech markets in the world.
Oh.
It's about $150 billion market opportunity, and this is a market growing at high single digits. It's interesting also to contextualize APAC comprises 60% of the world's population, but in terms of usage of medical devices and medical technology, it's probably only a third to a fourth at best. And just meaningful growth potential, both in terms of just all of the macro factors around an aging population, chronic disease, improving affordability. And it's a market which historically was frankly constrained by supply. It was served largely by either local players who were on the lower end of consumables or multinationals that were focused on the premium end. And that's changing. I think what's exciting in Asia Pacific now, and I'll come in a second to how AI can play a role in this, is you have a very evolving ecosystem where you've now got medtech hubs emerging in China, in India, and in some parts of Southeast Asia. This was historically a market served largely by North American, European multinationals selling products in these markets and some Japanese players. But now you've got these new hubs emerging. But also what you're seeing is an emergence of innovative Asian champions. So it's no longer the old view that innovation coming out of China or India or Southeast Asia is, me too innovation, but there are now technologies coming out of our markets that are sometimes, coming to market before even some of the Western products are coming in. And so that creates a supply base today that can support the unmet demand in this market that, again, technology can unleash a lot more of that access to the population.
Vikram, that was a great overview of the current landscape. Now, I'd like you to elaborate on how AI is specifically driving advancements in areas like diagnostics, treatment, and perhaps even operational efficiency.
Absolutely. So I think, if we take these pieces one by one, I think, when it comes to diagnostics, I think the way AI has evolved in terms of, for example, in radiology and pathology, algorithms that are able to take learnings from thousands of scans to provide just high quality diagnoses to complement, for example, in radiology or imaging, a radiologist's view. Now, that's just the first piece around technology being a co-pilot to provide a diagnosis. I think where we're actually finding, really an interesting unlock is in how AI is supporting the clinicians on being even more effective. And so when it comes to, for example, a radiology report that was, supported with an AI diagnosis read by a radiologist, but in terms of being able to write the report that goes to a clinician, which historically could have taken, 10, 15 minutes, now with technology transcribing, that can be done in 2 or 3 minutes. And when you look at markets like ours, where we've got such constrained talent and such a talent shortage, you are now allowing a radiologist to serve so many more patients and with much higher quality outcomes. And so that's on the diagnosis side. But in terms of, being able to bring devices to market, one of the challenges we've had, and I'll take Southeast Asia as an example, collectively very large market, but several different countries, several different regulatory regimes. And so if I wanted to bring a product to market in Southeast Asia historically, I would need to register it in multiple markets, go through multiple regulatory processes, have a big team to do this. And so what ended up happening was companies would focus on one or two. But today we're seeing some of the front runners saying, can I use AI to accelerate the filing process where I take US 510K, use generative AI to get it to 80% of the requirements in Indonesia, in the Philippines, in Singapore, and now I bring this life-saving product to market in 7 markets in the same time it would have taken me to get it into market in 1 or 2. And on the manufacturing side, we're seeing products that have AI embedded in helping, for example, in endoscopes, being able to help provide the clinician with advice on look for this, look for that, or on the manufacturing process, and the list goes on and on. You're almost seeing a reinvention of the entire end-to-end journey of from design to usage of medical devices being supported by AI.
Wow, that's a lot to unpack there. You have all the technological advances, and then you have your talent gap issues as well as regulatory concerns as well. So coming back to the application of AI, what's the most significant application in medtech right now?
I think today the most significant applications, again, I think we're seeing a lot on the diagnosis side. I think what we have also seen is I think companies are being thoughtful around how they sequence their approach to using AI to larger scale impact. And so while you're seeing use cases across R&D, manufacturing, commercial, and of course operational efficiency through it, what we're seeing companies find the right balance of using AI to accelerate market access, like some of the examples I just mentioned earlier, and then being very selective on where they embed AI into products to, again, make it easier for clinicians. And what's interesting is, especially in Asia Pacific, where we've got such a large shortage of healthcare practitioners, where we are seeing medtech companies lean in is on how do we make practitioners more effective so they can bring care to more and improve outcomes for more. We're seeing with many of our clients, that's the rate limiting factor for them. I think you're able to find the healthcare literate talent, you're able to find the technology literate talent, but people who understand both, I think that's where the magic is happening. And a lot of the time we spent with the medtech industry as part of this APAC Med effort was on how do you create more of that, because that becomes the unlock.
Vikram, I'd like to know, beyond diagnostics, medical imaging, AI is also making waves in predictive analytics and personalized healthcare. Your thoughts around that?
Great question. I think we are seeing, I think AI being used in many cases to be able to look at historical behaviors, historical healthcare patterns, to be able to provide some coaching and guidance. I think you're seeing this, frankly, not only in medtech. I mean, one of the important things, especially when you look at success in medtech, is a lot of the sectors, I look at the different sectors in healthcare almost like gears that need to work together. So, pharma working with medtech, working with the payers and providers. And I think where you're seeing a lot of the predictive analytics or the personalized medicine working across the seams of this. And so providers working with medical device companies, and in some cases insurers, to say, how can I provide the right health coaching to a patient? Or how do I take precision medicine to the next level in terms of using, not so moving out of just the wet lab and the dry lab to using analytics and patterns to predict. So, I think you're seeing a wide gamut of these.
And as you mentioned earlier, with AI rapidly evolving, there are bound to be lots of challenges as well. And you talked about a particular challenge from a regulatory perspective. Are there any challenges or hurdles that we're looking at in terms of AI in healthcare?
I think there is lots of opportunity, but I think there's also a lot of challenges. And I think I would bucket challenges across a few dimensions. One is, I think, just broader acceptance and comfort of an AI-led solution. And so, again, it's interesting, psychologically, what you see is when something is generated by AI, people just, the skepticism tends to be a little bit higher than if it was advice that came from a human. And so I think acceptance around that. And I think what we're seeing is more about humans supported by AI versus just AI on its own. I think there's the other big piece here. We talked about regulatory already, but I think the other piece here is on talent. And this was something we spent time on in the report we published along with our friends at APAC Med. Success in healthcare AI requires bilingual talent. And so these are practitioners who understand the healthcare ecosystem, but are also on the cutting edge of AI and machine learning. And that's a big talent constraint that we are seeing that is holding back to some extent the industry reaching its full potential. And we're seeing now, increasingly a focus both from a government perspective and from a sector perspective on finding ways to upskill talent, because that can be a massive unlock.
Now, in Singapore, as well as other Asian countries where the elderly population is growing, do we see lots of different AI-related technologies being developed?
Absolutely. I think what you are starting to see is increasingly there's a recognition that as the population ages, as people get sicker, how do you take care of them in a setting which they want to be taken care of? Everybody doesn't want to be in a hospital for everything else. People don't want to be in nursing homes. How do you help people get care at home? So I think where you're seeing AI technologies on remote patient monitoring, and so being able to manage vitals and being able to use AI algorithms to provide early warning so a caregiver can get involved. I think you're also seeing AI being used to help triage care into the right sites of care. And so I think you'll see medical technology powered by AI support a lot of, I think, where care is going in the future, closer to the patient, closer to home, in the community. Of course, large hospitals will always have a very important role to play, but for the appropriate care. And I think technology is playing an important role on allowing people to get the care they want at home with their loved ones, supported by a medical system versus being in a hospital.
Talking about roles, where do you see Singapore, excelling in terms of AI in healthcare? How do we, I suppose, shine in this space?
I think Singapore has a very unique opportunity as a hub for the region, has played a very important role. If I look at medical technology, for most large medical technology companies, Singapore has historically been a very large regional hub. But it's been focused more on commercializing medical products to be sold in the region. I think Singapore has a chance to play a role way beyond just commercializing product. I think as you look at a healthcare ecosystem for Asia Pacific that is built in this region versus imported, being able to build a talent base that can support on the R&D side, building a talent base that can support on the manufacturing side. It's interesting. I think the EDB has been supporting several companies to be able to bring manufacturing, advanced precision manufacturing into Singapore. A lot of that is actually supported with the latest technology in AI. I think Singapore can play a very important role on the R&D side, but that will require also a lot of collaboration with universities, with the government, with the public sector, which I think can create a massive catalyst for Singapore to play a very big role in the region on this.
Indeed. I think the region is seeing a lot of strong government support and increase in AI-driven healthcare startups, like you mentioned, collaborations, although there are some regulatory and perhaps even ethical considerations being some of the important concerns or conversation points that has to be addressed. Okay, Vikram, I'd like to spend a couple of minutes to touch on health monitoring and wearable devices. I mean, they've been around for a number of years now. How will devices like activity trackers that we're very familiar with evolve and hopefully improve our day-to-day life for better health?
I think if you look at the next generation of all of the health monitoring and wearable devices, they've all moved into some version of having a coach. So if you look at, even the Aura Ring, which many of us have today, has an Aura advisor that's giving you guidance on here's how you think about, here are the learnings from your sleep patterns and exercise, or you look at, the Whoop band. And I think you're seeing this now getting embedded across most wearables as a coach to help people act on the insights of the wearables, because that was historically a little bit, the wearables got you lots of good information, but the nudge to act on it and the insights around it, we're starting to see now that get embedded across the board on devices, which I think you will start to see that support the growth of that sector even more.
Now, looking ahead, where do you see the role of AI in medtech evolving over the next 5 to 10 years?
I think, again, we are long-term very bullish on the role AI will play in healthcare more broadly and specifically in medtech. I think we will see it almost be ubiquitous and across every part of how devices are designed to deliver care that is tailored to the N of one versus to a broader population group. AI playing a role in being able to get appropriate products to the appropriate locations in appropriate markets much faster, much cheaper. I think AI will play an important role also in helping us overcome some of the challenges we have with a constrained talent supply of clinicians, of nurse practitioners and caregivers. And so as I look, 10 years out, for us, we're very optimistic on the role AI can play as a catalyst to improve the outcomes in the markets we're in, to improve affordability of care. And I think the winners, as you look going forward, will be companies that lean in and will be also, I think, governments that support that. I think what you're seeing with the pace at which AI is evolving is at a pace that is very, very rapid relative to how the regulatory landscape is evolving in markets. And so governments that embrace this mindset of working alongside the industry to create opportunities, I think will create a catalyst for that change.
I totally agree. Ultimately, it's about finding ways to perhaps integrate AI to, make sure that the capabilities of professionals in the healthcare industry, all these things are working together to enhance patient care and perhaps improve the quality of healthcare services, don't you think?
Absolutely. Well said.
All right. Thank you very much, Vikram, for your insights this afternoon. He is Vikram Kapur, head of Bain Company's global healthcare and life sciences practice.
To listen to more great interviews, download our podcasts at audio.sg or download the audio app. That's AWEDIO, audio at the App Store and Google Play.